we had developed a word cloud based on all the wonderful comments we got. In any of these surveys that we do, there's an option to submit comments at the very end, which I'll say most people don't do. We get a small fraction. This exploded. I would say close to a quarter of those who participate in our survey left some comment. So we took all that and said, well, why don't we make a word cloud out of it, which is kind of an emerging trend in survey-based research. And the largest kind of phrase that was repeated on multiple occasions was, why social media? So I think the majority were asking, well, why do you need to use social media to attract patients, or why are physicians using social media for this purpose? I mean, we can all offer our own interpretations. Those who were most interested in following their dermatologist or seeking out dermatologists through social media, from a demographic standpoint, were younger, and they were more interested in cosmetic dermatology. That doesn't mean that others weren't interested in hearing about, in education, or, actually the number one thing, the general group that we surveyed, that responded to our survey, were interested were education, patient reviews, as well as even maybe some before and after pictures. So more related to that provider, that practitioner's expertise, and also their contribution to our overall fund of knowledge, rather than more personal elements, which certainly we see a lot of in social media. But in focusing on that group that really found this interesting and found it important, we're talking about those interested in cosmetics and younger. And this matches up really nicely to April Armstrong's recent paper in the JAAD, which looked at this from another side in terms of social media engagement by practicing dermatologists, and I put that in quotes, I'll tell you why in a second, but practicing physicians and looking at the different platforms with respect to who has the greatest engagement on those platforms, including Instagram, I believe Facebook, Instagram, Facebook, and I want to say YouTube. And it was different for each of those lists, the top 10. And what to me was very concerning about this was that the number one person for Instagram is not even a board certified physician. Dr. Orion, who's based out of California, is not board certified in anything other than being a fraud. And yet he has the greatest engagement of any. He calls himself a cosmetic dermatologist, but there is no board certification in that, nor is he a dermatologist or any board certified physician. Wow, am I being open enough? But I mean, that to me is scary, because you have this subset of the population who is seeking out their physician who's going to offer medical care, looking at social media as their prime resource for that. And then you have someone who's not even board certified having the greatest engagement. So that to me is concerning. And that where, once again, that guidance from above and that early education, getting in early during residency, is so important about, really meaningful use. The other side of things, so we're looking at this, so the list of people who are in this study versus who is most interested really comes together quite nicely. We're talking about really predominantly cosmetic dermatologists who are making these top 10 lists on those three platforms. So that makes sense to me. The problem I see is that if the majority of folks out there, we're taking, throwing the cosmetic interested folks, but lumping them into the majority of who we looked at in the survey study, if the majority of folks are looking for education, are these individuals the right people to be providing that education? If their scope of practice is really on cosmetic, should these individuals be providing education on broader dermatology subject matter? And should there be a certain expectation to be able to, be at that position? If you look at any of the conferences, national conferences, it's not like anyone can just stand up and say, hey, I'm going to give a lecture to 1,000 people. There needs to be a historical precedent for that. There has to be a reputation and a level of expertise. Not saying that any of these people don't have expertise. It's just that where's our marker? Where is our litmus test in terms of who should be getting that message out to the thousands upon thousands of people and who shouldn't be? And of course, what is meaningful use? My concern is, are you getting the right message out there? And if you are so focused on one particular area of dermatology, are you getting all the information that out there? Are you armed with the right information? Are you most up to date in the literature? And the answer may be yes or no. Not to say that it can't be that way, but how do we know? How do we know that that person has that fund of knowledge to provide the right information to the masses who are taking this person at their word as an expert in this area? So I think that, you know, in looking at both of these studies, you know, we really need to start thinking about how to kind of guide those who are going to use it the most. And no question, it's going to be those coming right out of training, and how to use it in a way that's both effective, but also evidence-based.